Hello, everyone. My name is Rosalind Conic. I'm a PGY3 at the University of Florida. I'm actually your Fit Council AMA liaison, and I have the pleasure of welcoming you to another round of Q&A interviews with Dr. Stephen Flanagan, current president of AAPM&R, as well as chair of rehab medicine at NYU Grossman School of Medicine and the medical director of Rusk Rehab at NYU Langone Health. So today, we're going to be discussing advocacy and practice. Specifically, more about the Academy's advocacy efforts, impact on our vision, why it's essential for PM&R physicians to get involved, and more. So, Dr. Flanagan, I'd like to start off our Q&A by focusing on the barriers PM&R needs to address in order to advance our specialty towards our bold vision. I loved your recent editorial in The Physiatrist, where you talk about the advocacy as one of our barriers and going into more detail on the Academy's advocacy efforts currently and the power that we have in numbers. Could you share more about AAPM&R's advocacy initiatives, particularly those that have an impact on our vision?
Rosalind, thanks so much for interviewing me today and for asking a really good question. So, hey, first of all, I think I just want to start off by saying that the Academy is one of the primary medical specialty societies, and so as such, we are a society of physiatrists for physiatrists. And that's why it's so important to support the Academy, because we're supporting the field and your practice of PM&R, whether you're just starting out or you've been in practice for several decades like myself. And one of the things that we do with regards to our advocacy is to really make sure that we're positioning PM&R physicians as the essential leaders across the healthcare continuum. And that's really part of our PM&R Bold mission. And a lot of our advocacy efforts, as it turns out, isn't glaring. It isn't always so obvious, but I can assure you there is a lot of stuff going on behind the scenes. Some of this we publish in the Physiatrist and some of our emails that we get. I know you're bombarded with all of those things, but it may be worthwhile for folks just to take a look at it to really get an idea of just the scope of what we're doing with regards to advocacy. But I will say this, in order to really be effective in advocacy and to advance physiatrists, which is really the goal and the purpose of the Academy, that advocacy has to be extensive, has to be strategic, and really highly coordinated. And I can tell you that the Academy is really doing a great job with that. And we need to take a look at all of the multiple venues that we can use to make this happen. It's through media, looking at, can we get onto TV, radio, newspapers, podcast, really making sure that we can get the word out, the value that physiatry adds to medicine. People think advocacy is, going to Washington or your state capital and, getting into the office and pounding your fist on the desk of your representative. And by the way, we do that, but maybe in a nice way. But we do so much more than that. But let's take that last example, advocacy, for legislation. So every year, a group of physiatrists from the Academy, as well as some of the folks that we work with in Washington, have our Day on the Hill, where we go into, a couple of dozen congressional offices and advocate for what's really important for physiatry. So an example, what did we do in 2023? Well, we focus on advocating to reduce that burden of pre-approval or prior authorization for anybody who's been in practice for a while, getting authorization for everything we do, an ENG, an MRI, or whatever it is that we do. I mean, think of the time and the energy that takes up when we should be treating patients. We consistently fight for ensuring that we get paid what we deserve, preventing physician fee cuts, and ensuring that the payment to PM&R physicians is really what we deserve. We advocate strongly to prevent encroachment of other fields or other specialists doing what we do, and particularly non-physicians. Strongly advocate for that. We strongly advocate to have physiatrists determine who is a real candidate for an inpatient rehab admission. That should be our decision because nobody knows that better than we do. So we stand up against the what's called the NGS and CMS audit, where they go in and just deny cases, because they have a vague definition of what's medically indicated for an inpatient rehab facility. We advocate to expand telehealth. As physiatrists, we are treating people with disability who can't always make it into the office. I know I live in New York City, where sometimes it's hard to really navigate, but that could be true anywhere in the country. So we advocated for that. In those congressional office visits, we advocated to ensure that physiatrists continue to be the lead in long COVID care, knowing that we are the specialty that owns disability. We treat many different body systems, but nobody can claim to be the specialty of disability like physiatrists can. So we want to continue to advocate for that. And we also want to advocate to help our physicians navigate through the end of the public health emergency. This is really just a sampling of some of the things that we do to advocate. But that's what we're doing. There's so much more that our members can be doing as well in their own local worlds. And we'll probably get into that in a little bit. Again, a sampling of what the Academy is doing to advocate for the field and for physiatry. It's all part of PM&R Bold. We want to make sure that through our advocacy and everything else that we're doing, that we just don't survive the craziness of healthcare change, but rather thrive going forward. So that physiatrists are seen by the key stakeholders, patients, C-suite, insurance companies, legislators, as being vital, essential, and indispensable in reaching that triple aim of medicine. Better population health, better patient experiences, and doing it more efficiently, which we all know is a government euphemism for less money.